Hello, my name is Dr. Aram Jawed and I'm a board certified general and bariatric surgeon. Today, I'm going to be talking about surviving the COVID-19 pandemic with obesity and obesity as a major risk factor. When COVID-19 started spreading across the globe, there was very little insight as to what the major comorbid conditions were that caused hospitalizations and the need for intensive care. Age appeared to be the greatest risk factor, followed by cardiac or heart disease, and pulmonary or lung disease, and smoking. Unlike what the world had seen in China and Italy, here in the United States, we have been seeing a lot more younger people who are not elderly who are hospitalized and needing mechanical ventilation. Many of these younger patients who end up in the ICU actually don't have many comorbid conditions. New data clearly shows that after age, obesity is the number one risk factor for becoming critically ill with COVID-19. As you can see from this graph, obesity is the number one risk factor if you're under the age of 64. This is followed by high blood pressure, chronic lung disease, and diabetes. In the epicenter of New York, recent studies have found that if you have a BMI or body mass index greater than 30, you are twice as likely to become critically ill and require hospitalization with COVID-19. In addition, the higher your body mass index is, the more likely you will require critical care. The largest US study to date coming out of New York, which looked at more than 4,000 patients, demonstrates that after age, obesity is the single highest risk factor, higher than both lung disease and heart disease, for both requiring hospitalization and needing critical care with COVID-19. Obesity is a pro-inflammatory condition that decreases your immunity with your body's inability to fight the virus. Other issues with obesity is that many people have underlying unknown comorbid conditions such as diabetes, high blood pressure, and obstructive sleep apnea, to name a few. So let's talk about how the virus actually attacks the body. Viruses bind to cells in a lock and key mechanism. The virus binds to a cell, which opens the lock, and the cell allows the virus to go inside. The cunning virus then shows a blueprint of itself to the factory or mechanisms inside our own cells, which then begin to replicate more virus. When the virus overcomes the ability of the cell dies, releasing more viral particles. These viral particles, then go throughout the body and infect other cells and create more mini virus manufacturing plants inside our body. Our body needs to direct its own immunity against these viral infected cells. The body cannot effectively attack the virus with immunity if we are in a chronic inflammatory and immune deficient state, as seen with obesity. Additionally, it has been proven that obesity has high rates of vaccine failure. This is due to dysfunctional immune response in obese patients. Obesity has been shown to have an impaired immune response to the influenza vaccine. According to the CDC, more than 1/3 of Americans are obese and 17% of children are obese. Dieting and exercise are widely ineffective for long-term weight loss and resolution of comorbid conditions. We here at Advanced Laparoscopic Surgeons pride ourselves in offering surgical solutions for long-term weight loss and resolution of health problems related to obesity. Patients following metabolic procedures such as sleeve gastrectomy and gastric bypass rid themselves of comorbid conditions such as diabetes, sleep apnea, high blood pressure, and many other health problems. Not only do they increase their lifespan and quality of life, but also their immunity. The only method of attacking and successfully killing the virus at this time. We congratulate our patients for achieving a healthy lifestyle and increasing their chances for successfully overcoming this pandemic. Continue to eat healthy, take your vitamins, stay hydrated, practice social distancing, and stay safe.